I want to talk a little bit about the rear end. A lot of stuff goes on back here. Okay? The tail serves an important function, which is why you don't want to dock them. It's there to help them ambulate. If you notice when dogs run, there's a pattern that their tail moves at. When they swim, you'll actually see a propeller motion. So it's really important to look at tail carriage. If the tail is held low, it doesn't seem to want to come up, there clearly could be pain in the rear end of some sort. It's helpful to also look to see if the dogs are engaged back there because they may have some discomfort underneath the tail. Get used to looking underneath here as well and looking to see what your dog's normal anus looks like. I can't tell you how many times people come in and say, the dog's not right, it's scooting, and I think he's got a problem back there. You lift the tail up, and especially in long-coated breed dogs, you'll see just feces impacted against the rectum, which now has to be essentially removed through a somewhat uncomfortable procedure because everything is stuck and it's infected and it's a mess. Also, look back here and see if you see any swelling, because dogs have these modified scent glands called anal sacs, S-A-C-S. Anal sacs supposed to secrete a discharge material onto the feces, which serves as a scenting purpose. And in some species like skunk, they're modified as a form of defense. The anal sacs many times will either become impacted or become infected, or they can even go as far as become abscessed and ruptured. So if you see a swelling, typically between 5 o'clock on the right side or 7 o'clock on the left, that could be indicated that your pet's anal sacs need to be addressed. And lastly, at the base of the tail, if you see that the carriage is being held low, there may be pain there because of a musculoskeletal problem, or if your dog is doing a lot of swimming, something called swimmer's tail can commonly be a problem. So that's something you want to watch for.